Between the Ministry of Health and St. John Ambulance to handle emergency medical services. Speaking during the graduation ceremony of 62 emergency medical technicians in Nairobi, St. John Ambulance Chief Executive Officer Dr. James Wanjagi said the organization is ready to fill in the gap in provision of medical services in the country. The emergency response services has been hampered by inadequate funding, now addressed under the Social Health Insurance Act under the Emergency Chronic and Critical Care Illness Fund.
We are an augment support system for the Ministry of Health. So when we do things like that, we are really creating the opportunity for young men and women across Kenya to get the skills that they can use when there is an emergency, when there is an incident. Remember, pre-hospital care is an emerging practice, and so we want to be at St. John at the forefront. So even as the Ministry of Health creates policies and supports in that arena, we want to be the ones who help implement this kind of services, this kind of pre-hospital emergency care to everyone in Kenya.
Is in line with Health Act, which talks about every Kenyan being able to access emergency medical treatment without being denied. Now, the mechanism for funding that was never existent until this year, that now the Social Health Insurance Act has now been established. And in that act, there is the Emergency Chronic and Critical Care Illness Fund, ECIF, which is meant to ensure that this service is reimbursed. What that means then is that then we should invest more, not just in the personnel, but in the tools that enable that response to take place. Now, that response is from home to where care can be given.
Mukutani area of Baringo South constituency